The first question is very interesting, whether Omicron is mild. In English language, some words cannot be used to accurately portray what it means in science. And that's a disconnect between literary English use and clinical or scientific English use. Both are different. For example, I'll give you an everyday example. When a doctor says there's a risk of an event happening, the doctor means the odds or a chance of an event happening. But for the common man or the layperson, it means something very dangerous. So the word risk means different things in different settings. Likewise, when we say mild, it simply means that the overall profile of cases, if you take a large area or a large geographical area, yes, the overall impact is mild. And many individuals have no symptoms at all. And that was also observed in the first variant and also in the Delta variant. But the proportion of people with no symptoms at all is perhaps more for Omicron. And if you talk to anyone who was bedridden with Omicron, they will strongly disagree with the statement that it is a mild illness. In fact, they feel offended if you use that word mild. So I'll qualify the word mild as less severe. I think that is more scientifically apt to use the word less severe. In terms of whether vaccines work, definitely yes. In fact, if you look at all the data we are getting on the ground, collective experience of doctors who are actively treating the sickest of the sick COVID-19 patients as of today, they will all tell you that the number of people who are coming in who are ill are almost exclusively unvaccinated people, or those who are not fully vaccinated. So that's one. And the second subgroup are really older and more frail people who by default are at greater risk for bad outcomes. So those two categories, yes, vaccines, they do work, but the overall impact of vaccines is that for Omicron, the first thing to remember is the variant itself is about loosely 20 times milder. I'll tell you why I said that. There is a study out of Kaiser Permanente from Pasadena, California, that looked at a large number of individuals who were infected with Delta and with Omicron. And they found that the chance of a person being hospitalized after a Delta infection was 1 out of 50, 50. With Omicron, it is 1 in 900. So by default, Omicron by itself is causing fewer complications. And among those who got ill with Omicron in hospital, there is an approximately 70% reduction by the paper published today in the New England Journal. It's a letter that came out of South Africa that looked at 2-dose vaccination in South Africa and their impact on their hospitalizations. So anecdotally, experience on the ground says, yes, vaccines are effective against severe disease. But as Dr. Abraham said, vaccines are not very effective against stopping infection, because we are seeing people who are previously vaccinated easily pick up the infection, especially if they expose themselves to the possibility of picking up the virus by mingling with people in indoor settings. When we talk and when we eat together, that's when the virus spreads, and the virus makes no mistake in getting into a fully vaccinated individual. And that has also occurred overseas among boosted individuals as well. There is an episode out of Faroe Islands near Denmark where 33 healthcare workers who were triple boosted with the Pfizer vaccine went for a party after testing negative. And 21 of them came down with what I described as rather severe symptoms that just did not require hospitalization. So which means that if you give the virus a chance, it will infect you. So the message is, do not give the virus a chance to infect you.